It's a good segue to my talk because I'm going to be speaking about some regenerative type medicine injections. And these are all done under guidance, so ultrasound or x-ray, as Chris just reviewed. So platelet-rich plasma, PRP, that's been around the longest. So as early as the 1970s, people were using PRP. It was first used in open heart surgery in 1987, but it really became extremely popular in the mid-90s. So Tiger Woods, everybody knows Tiger Woods, he had some PRP injections after knee surgery, and that's when people really got interested in it and really were kind of demanding it from physicians. So if we look at blood, it's made up of 93% red blood cells, 6% platelets, 1% white blood cells. And there's some plasma as well. Platelet-rich plasma, on the other hand, it's made up of 94% platelets and plasma, 5% red blood cells. So you can see the definition of PRP is there's a 3 to 5-fold increase of platelets above baseline. So anything less than that would not be considered PRP. So, why do we think this is helpful in orthopedic medicine or sports medicine? We do know that platelets have many, many growth factors associated with them. So the idea is you take these platelets, you inject it into areas that don't tend to heal well on their own. These growth factors stimulate stem cells to come in, and it's actually promoting healing in areas that don't tend to heal well on their own. So things like tendons, ligaments, we know they have a horrible blood supply. So the idea is you take that blood, you take those platelets, growth factors, you get stem cells to come in, and you're promoting healing in areas that don't tend to heal well on their own. So how do we get this? So patient comes into the office, we draw up their blood, usually just from a vein in the arm. We then put it in a centrifuge machine which separates it out. Then we take the part that's rich in platelets and we inject it into areas that don't heal well. So if you look, once it separates at the bottom, that's the red blood cells. In the middle, that has the platelets, or what we call the Buffy coat and those growth factors, and the top is platelet poor. So where can we use it? So you have to be a little bit careful. If you look on the internet, it could be used for almost everything and anything. You'll see websites, cures rheumatism, sports injuries, will grow your hair back, get rid of wrinkles. So you have to be a little bit careful. We do know that in terms of orthopedic medicine, there have been studies that shows its utility in meniscal injuries, tendonitis, arthritis, again, ligaments, tendons, things that don't heal well on their own. Runners, jumpers, knees, arthritis, and even peri and post-operatively, so trying to speed up healing in surgery, it's being used. So post-injection therapy, looks like he's resting very nicely, right? And that's what we ask patients to do. So for 2 weeks, we really tell them to rest. The idea is you have healing taking place and you don't want to do anything to get in the way. So sometimes for upper extremity, we'll put them in a sling. Lower extremity, sometimes we'll give them crutches. We tell people really to steer clear of non-steroidal anti-inflammatories. So these are things like Advil, Aleve, Motrin, and the idea is these are, it can inhibit the healing process, and you don't want to do that for the first 2 weeks when the healing is really taking place. And we tell them to stay away from high-impact activities. So for upper extremities, no throwing, lower extremity, no running, jumping. And the good news is it's a very, very, very safe procedure. So in terms of platelet-rich plasma, there's really no adverse reactions that have been reported in the literature. So you could think it's your own blood, it's very safe, there's no infections. What we do see the most is you can feel worse before you feel better. So you can think of it again, it's this acute inflammatory process taking place, and that could be painful until that inflammation settles down and healing takes place. So that brings us to amniotic growth factors. These are a bit newer. You'll see it being advertised a lot more now, orthopedics, rheumatology. And amniotic membrane, that's a placental tissue that supports development of the fetus during pregnancy. It's made up of collagen, fibronectin, laminin, has many, many different growth factors, cytokines. And what we do is you can actually dehydrate these membranes into human amnion and chorion membrane allografts. That's what we use in practice. And it's been around for a while in terms of diabetic wounds. So diabetic wounds, ulcers, they weren't healing well. There's been a lot of studies that show that it actually speeds up healing. And because of that, it's now, really the interest has sparked in orthopedic injuries, again, for things that don't heal well, like tendons, ligaments. Can this kind of speed up the process? So where do we get them from? So we get these from planned C-sections, so full-term live births where the mothers have given consent. The good news is that amniotic products don't have HLA antigen. So that's an antigen that allows your body to notice something as foreign. And because it doesn't have this HLA antigen, there's really no reports of rejection or infection or anything like that. And just like a blood transfusion, they test it for any kind of infectious diseases. And if any are found, obviously it's discarded. So what does it look like? So honestly, it looks like a powder. It's dehydrated, and what we do is we reconstitute it with saline, and then we re-inject it back into areas that don't heal well. So I think this is a very important slide because it's really a lot of people are confused about this in terms of, do amniotic cells have stem cells? You'll see a lot of practices, they are advertising amniotic stem cell injections, but if you look in its natural state, umbilical cord, blood, placental tissue, and amniotic fluid, in their natural state, they have tons and tons of stem cells. But the problem is once you cryopreserve or you freeze it, no stem cells survive. But the good news is what does survive is tons of growth factors, hyaluronic acid, other proteins that really promote healing. So there are lots of good things in there. It's just there are no stem cells there. So that brings us to stem cells. So these are undeveloped biological cells. They're capable of proliferation, self-renewal, conversion to differentiated cells. So these are cells that have the potential to become any other cell in the body. So where do we get these from? So you can get them from bone marrow, periosteum, adipose or fat tissue. Again, placental, umbilical cord, blood, human amniotic fluid, all of those only in their natural state, dental pulp, synovial tissues, skin and skeletal muscle. So among these, we most commonly get it from the bone marrow and the fat because it's the most abundantly available and it's the easiest to get to. So how do we get these cells in practice? So patient comes in and you do a bone marrow biopsy. So that's where you put a needle into the bone, usually in the iliac crest or the pelvis. Or you can get it from a lipoaspirate, so like a mini liposuction, which sounds pretty good to most people, but it is much more invasive than a simple blood draw. And again, it's important when you look at these stem cells, you can either get unselected cells, so that means you do your bone marrow biopsy or your lipoaspirate, and then you spin it, take the stem cells and re-inject it right away, or you can actually culture it. So that means 2 weeks, you're culturing them, you're getting more stem cells, and then you're re-injecting them. But it's important to know that right now in the United States, you cannot culture stem cells. So initially when stem cells became popular, a lot of companies were culturing them, getting more of them and re-injecting them. The FDA then decided, wait a minute, you're manipulating cells, this is like a drug, you really need FDA approval, and they stopped it. So, there's a company called Regenix. They initially had a lab in Colorado where they were culturing cells and re-injecting them. That lab shut down and they reopened in Cayman Islands. So you hear a lot of patients, they're flying out to Cayman Islands, they're getting their stem cells drawn up, cultured, re-injected. And again, it's important to know, are they cultured or are they not cultured? Because if you look at the initial studies, a lot of them were with cultured stem cells. But there are also studies non-cultured that do show efficacy. So where are we using stem cells? Currently, orthopedics, arthritis, spinal cord injuries, chronic tendonitis, bone fractures, again, all these areas that don't heal well on their own. And in summary, which is best? Tough question, because there's really no double-blind randomized controlled studies that look at PRP versus the amniotic growth factors versus stem cells, unfortunately. So we don't have the data to really know. But the good news is they're all relatively safe. So if you look at platelet-rich plasma, it's your own blood. You look at amniotic growth factors, there's no HLA antigen, it's all tested. And then stem cells, again, it's your own, but it's a little bit more invasive. So what I usually tell patients, start conservative, simple blood draw, amniotic, right? It's much less invasive than the bone marrow aspirate or the lipoaspirate. I could say in practice, just anecdotally, we've had some cases where we've done PRP and the results have been, okay, not as well as we'd like. We've added in those amniotic growth factors and the results do look better. And if that doesn't do what we like, I think the stem cells is a really nice, safe option.